Hello, welcome back to another video. My name is Myrian. In today's video, I'm going to show you how to set up for a brain scan. So first, I want to show you the coil. So this is how it looks. This is for a Siemens scanner. So it has different pieces to this. So I'm going to take this part off. This is the anterior part of the head coil. This is how it looks. And then this right here is like the posterior part where the patient's head is going to lay in. So this part comes out. It's like for their head and for their neck to rest. And then I also like to put the head cushion beside the patient's head so that they do not move. And then you also want to make sure that you're giving them earplugs. So it does snap back on. I'm not sure how well you can see it, but you just put it like this. And it snaps back on in place. And then it also show you where to center at for your patients, like this line right here, if you can see it right there. So now I will show you all how you move the patient in and how you set it up for the actual MRI brain scan. So give me 1 second. Okay, now I'm showing you how to set it up. I normally just press the button and let the table all the way up so that I do not have to keep bending over all day and hurting my back. I do remove the cushions for the head. I put the posterior part into the actual groove on the table, take the head piece off and just let it rest in the scanner. I have my earplugs, and then I go get a pillowcase and a sheet to put on the table. And then I normally cover the head piece up with a pillowcase so that the patient does not have to touch it. And then I put a clean sheet on the table. And then I just make sure that it is covering the table so that the patient can feel comfortable. And then I let the table down because you do not want a patient hopping up on the table. And you will put the head coil on like this once you have the patient into the scanner ready to go. And then I just let it rest in the scanner. And then I bring it all the way down. And then the screen will let you know that you have your coil. Another thing I wanted to add is there are times where we cannot put the head coil that you've seen, the anterior part, onto a patient's head, depending on maybe it just won't, the camera won't fit or the coil won't fit on the patient's head. Maybe the head is just a little bit bigger for the head coil, or it could be the patient has back problems or neck problems and they cannot lay flat or they cannot lay their head flat. So some patients want you to build their head or neck up a little bit higher, especially if they have neck pain. So in that case, you cannot put the head coil on or the anterior portion of the head coil because it will bump their nose, or their nose will kind of get squished onto the head coil, which will make it uncomfortable. And then you do not want the coil resting on a patient's skin. So in that case, you can use the posterior head coil, but just make sure that you probably need to use like a flex coil to wrap around the patient's head. I didn't notice at first whenever I was training as a student, because the clinic that I worked at, they had patients that would walk and talk perfectly, and you didn't have to worry about that. But if you work at like a hospital, then you will have to kind of deviate out of the standard of what you normally would do for a normal patient, and then just kind of adjust to what the other patient that you have needs your adjustments to. And then another thing you can do, if you have a patient and you're doing like an MRI foot exam and their foot cannot fit in the MRI coil or the MRI foot coil, you can use the MRI head or brain coil to put their foot in. So it's a lot of ways you can do MRI scans. So if you are a new student and you're learning MRI scans, feel free to leave a comment letting me know, hey, you're a student, or maybe you're interested in MRI, or maybe you are about to start clinicals. But if you have any questions, feel free to leave them in the comment box. If you enjoy videos like this, just please give it a thumbs up. Thank you all for watching.